Exercise for chronic back pain. Please consult your primary care provider or physical therapist before starting an exercise program. This video is designed to help you perform the correct technique of exercises that have been given to you by your healthcare professional. This strengthening and stretching program is designed to increase your strength and flexibility so that you can perform more activities you enjoy with less effort. Choose a time of day that best fits your daily routine. Please contact your primary care provider or physical therapist if you have questions or concerns. Partial curl-up. Begin by lying on a bed or a mat on the floor. Bend your knees, putting your feet on the bed or floor, hip distance apart. Cross your arms across your chest. Gently tighten your abdominal muscles and lift your head and shoulders as a unit. To keep your head and shoulders moving as a unit, it helps you to pick a spot out on the ceiling and watch it. This way you protect your neck during the exercise. Be sure to breathe normally as you complete the exercise. Repeat this for 10 repetitions for 3 sets, 3 to 5 times a week. Common errors. Moving your pelvis during the exercise. Having trouble lifting your shoulders off the floor. Be careful to keep your pelvis in a neutral position. Don't flatten your low back to the floor. If crossing your arms is too hard, hold your arms straight with your arms by your sides and then lift your shoulders off the mat or floor. If it is too easy with your arms crossed across your chest, make it harder by putting your fingertips by your ears and elbows out to the side. Bridging. Begin by lying on a bed or mat on the floor. Bend your hips and knees so that your feet are on the floor or mat, hip distance apart. Gently tighten your abdominal and buttock muscles. Raise your buttocks off the floor or bed to create a bridge. Be sure to breathe normally as you complete the exercise. Repeat this for 10 repetitions for 3 sets, 3 to 5 times a week. Common errors. Moving your pelvis during the exercise. Be sure to keep your pelvis in a neutral position. Don't let your pelvis drop or your back flatten or overarch. Lower trunk rotation. Begin by lying on a bed or mat on the floor. Bend your hips and knees so that your feet are on the floor or mat with your feet close together. Rest your hands at your side and keep your knees together. Exhale and slowly rock both knees to one side until a gentle stretch is felt on the outside of your hip or back. While breathing normally, hold the stretch for 30 seconds and then inhale as you return to the start position. This stretch may be done daily. Repeat 3 times to both sides. Common errors. Lifting your hips and back off the table. Moving too fast and not feeling a stretch. Keep your hips on the bed or mat. Don't try to go too fast and lift hips off the floor. Seated forward bend. Begin by sitting on a sturdy chair on a non-slip surface. Put your feet and knees wide apart. Gently bend forward, reaching toward the floor between your knees until a gentle stretch is felt in your low back. Return to the starting position. Breathe out as you bend forward and breathe in as you come back up. You can put your hands or forearms on your thighs to help control the stretch. Hold the stretch for 30 seconds. Repeat 3 times. This stretch may be done daily. Common error. Holding your breath when you bend forward. Overstretching. Be sure to blow out as you bend forward and breathe in as you come back to the starting position. Seated hamstring. Begin by sitting on a sturdy chair on a non-slip surface. Bend one knee, putting one foot flat on the floor. Straighten your other leg, putting your heel on the floor. Tighten your abdominal muscles to keep your back and hips in a stable position. Gently lean forward from your hips until a stretch is felt behind the straight thigh. Breathe normally as you hold the stretch for 30 seconds. Repeat 3 times on each side. This stretch may be done daily. Here is an alternate position to stretch your hamstring. Lying down on your back, raise your leg and hold the back of your thigh until a stretch is felt behind your knee and thigh. Common error. Letting your back round as you bend at your hips. Letting your back round as you stretch. Overstretching. When bending forward, you can probably go farther as you let your back round, but this does not allow you to stretch the correct muscle on the back of your thigh. Remember to tighten your abdominals to support your back. Don't let your back round. Keep your gaze forward. Feel a mild stretch behind your knee or thigh.